My name is Alexis Gayton, and I am currently a patient care technician on the third floor at UMC, and I have been working in the medical field for roughly about 8 months now. As a patient care tech, my job entitles taking vital signs, cleaning up patients, and helping patients with their activities of daily living. PCTs help with overall care of a patient because they help the nurses out when they get busy passing meds and doing other things, and we just help with cleaning up and getting the patient out of bed and taking the vital signs for them to make their life a little easier. A typical shift in my day is usually about 12 hours long. We start off taking vital signs in the morning, and then we go and clean up the patients, get them ready for the day, brush their teeth, wash them up, and then we pass their breakfast trays, document what they eat, and then we continue cleaning them up, take vital signs again, pass lunch, and you kind of just repeat that all day long. Some of my favorite things about my job is walking in every day and seeing smiles on my patient's face when I walk in the room and making their day better and giving them a chance to talk to someone, because a lot of them are lonely. They don't have many people to talk to, so we give them the chance to talk to them. And I just like when their health improves and seeing the improvement overall in their mental and physical well-being. In order to be a successful PCT, you really have to have it in your heart, and you really have to be patient and caring for all the patients around you. And you just really, if you have the heart for it and the patience and respect for everyone around you, then you'll be fine. My main inspiration of getting into the healthcare field was my little brother. He was born at 1 pound 8 ounces at 26 weeks old, and he stayed at the NICU for 3 months. And I went to go visit him in the hospital, and I looked around and saw all the nurses and how great of a job they did and taking care of their patients, and it just inspired me. And that's when I realized that's why I wanted to be a nurse. In high school, I took a lot of college classes and got a lot of college credit for them. Then my senior year, I took Health Careers Academy. In the Health Careers Academy, we were certified in CPR. We learned about a lot of medical terminology. We did a lot with biology, psychology, which all counts for college credit and transfers over to your college, most colleges. And from there, and you get to shadow a lot of people and see realize what nurses do in a day. And then I am now a sophomore at Niagara University in their nursing program. I just did my first clinical rotation this week, and it was very interesting to see how different hospitals interact and the different way they get to work. And I would highly recommend taking Health Careers Academy because a lot of the college credits transfer over, and you just get a head start, and I'm just a step above everyone else when it comes to medical terminology, and you just get your foot in the door sooner. If you are thinking about joining a nursing program and going to a college anywhere around here, I would highly recommend working at UMC. They have a great program as a patient care technician. You work per diem, and you only have to work 2 shifts a month, so it's very doable with work schedule and schooling. And as you know, nursing gets to be a little crazy sometimes. Nursing school is hard, but it's mostly just on the job. You work 2 shifts a month, and that's it. And it's nice because not only are you getting paid for it, but you're also getting hands-on experience, and it helps put the 2 and 2 together between your schoolwork and your job in itself. My advice to middle and high school students who are looking to go into the healthcare field would be to take every opportunity you can get. Take advantage of those opportunities because those will help you in the long run. The more experience, the more successful you'll be. And specifically as a patient care tech, you don't need any requirements. You can come in straight out of high school, and we'll teach you on the floor, and it's a good way to get your foot in the door before you go to college, or even if you just want a PCT, be a PCT, that's fine too. There are many benefits of going into the healthcare field. If you're thinking about it, I'd highly recommend it. You have good job security, and there's options everywhere you look, and there's always a place that you can go in a lot of different fields. And it's a very rewarding job, and watching patients' health improve and seeing the smile on their face every day, and it's just a job it's an experience that you don't see anywhere else.